Metabolic health at its very basic level refers to how efficiently your body processes and uses the food that you take in for energy. When your metabolism is running smoothly, you're much less likely to develop chronic disease. Sadly, only about 12% of people in the US are metabolically healthy as of 2018. The syndrome was first described as a combination of 5 conditions, which include high blood pressure, elevated blood sugar, excess body fat around the waist, also known as visceral fat, and abnormal cholesterol and triglyceride levels. Having 3 of these conditions out of the 5 factors qualifies you as having metabolic syndrome. Hello, everyone, and welcome back to the Extend podcast, where we're going to explore the science behind living your healthiest and longest life. On today's solo-sode, I'm going to talk about the incredibly important world of metabolic health, how it works, why it matters, and what you can do to optimize it. Metabolic health is a topic that everyone should become familiar with because it is one of the root causes of all chronic disease. Metabolic health was first described about 30 years ago when a doctor at Stanford described Syndrome X, now known as metabolic syndrome. This is a cluster of conditions that occur together due to insulin resistance that increases your risk of heart disease, stroke, type 2 diabetes, Alzheimer's, and even cancer. The syndrome was first described as a combination of 5 conditions, which include high blood pressure, elevated blood sugar, excess body fat around the waist, also known as visceral fat, and abnormal cholesterol and triglyceride levels. Having 3 of these conditions out of the 5 factors qualifies you as having metabolic syndrome. Today, we're going to touch upon the role of mitochondria, the key biomarkers to track for metabolic health, and how tools like continuous glucose monitors, also known as CGMs, can help you take control of your metabolic health, and all the incredible benefits of doing so. We'll end the episode with practical, everyday tips that you can use today to flatten the glucose curve and stabilize your energy levels. So let's get started. First, it's important that you have a clear definition of metabolic health in your head before we get started. Metabolic health at its very basic level refers to how efficiently your body processes and uses the food that you take in for energy. When your metabolism is running smoothly, you're much less likely to develop chronic disease. Sadly, only about 12% of people in the US are metabolically healthy as of 2018, according to a large study published in the journal Metabolic Syndrome and Related Disorders. That's incredibly alarming, and it's why it's critical for everyone to have an understanding of this topic. Your metabolism actually takes place within tiny structures inside almost every cell called mitochondria. Mitochondria are the batteries that power every cell in your body. They convert the food you eat, which has already been broken down into glucose, amino acids, fatty acids, and usable energy, into the form of energy called ATP. When they're working well, you feel energetic, your brain is sharp, and every function in your body functions optimally. But when your mitochondria are overworked or damaged, most often due to poor diet, chronic stress, or lack of exercise, they become less efficient, and you have less of them in every cell. This can lead to fatigue, inflammation, and different levels of metabolic disease, like prediabetes, fatty liver disease, and then obesity. To be clear, however, you do not have to be obese to have metabolic disease, as many people also have a condition called TOFI, an acronym for thin on the outside and fat on the inside. The key to supporting mitochondrial energy production is giving them the right inputs: nutrient-dense food, movement that challenges your body, good sleep, and avoiding toxins like excess sugar, processed oil, refined grains, and environmental toxins. To learn more about metabolic health, I highly suggest you read the book called Good Energy by my friend Dr. Casey Means. As we said earlier, it's incredibly important to know if you're developing metabolic disease because of the consequences of having it are disastrous. Metabolic syndrome significantly increases your risk of cardiovascular disease and heart attacks, type 2 diabetes, non-alcoholic fatty liver disease, chronic kidney disease, sometimes leading to a kidney transplant, stroke, and even some cancers like colorectal and breast cancer. Dr. Christopher Palmer, who I've also interviewed for this podcast, wrote an amazing book called Brain Energy, which discusses how metabolic disease leads to all forms of mental health issues like anxiety, depression, OCD, PTSD, and even schizophrenia. So I hope you can see how it is critical to avoid metabolic disease so that you can avoid all forms of chronic disease and mental illness. And if you're suffering from any of these problems, treating your metabolic disease is foundational in treating both mental health and chronic disease issues. So, how do you know if you have metabolic disease? Well, the situation with metabolic disease is actually a perfect example of why having your blood biomarkers checked early and frequently is critical. Metabolic health can vary by ethnicity and gender, activity level, family history and genetics, and your hormones, microbiome, and level of toxin exposure play a role. So it's incredibly important to recognize how personalized your risk is. Blood tests can tell you early in the disease process, sometimes 10 to 20 years before you have symptoms, that you have metabolic disease, when it's still early enough to reverse the damage that metabolic disease can do. It's a tragedy that many traditional yearly blood panels don't check these markers until it's too late. So you have to take this list to your doctor and insist that they check for them. I have the list in the show notes, as well as a link to where you can order an at-home fingerstick blood test to get these markers tested easily at home. Here is my critical biomarker list that you should ask your doctor to obtain for you. Number 1 is fasting glucose. This measures your blood glucose levels after not eating for 8 to 12 hours. Ideally, this should be below 90 milligrams per deciliter, and if it's over 120, this is an indication that metabolic disease is taking hold. Number 2, hemoglobin A1C. This is a marker of your average blood sugar levels for the last 2 to 3 months. Aiming to keep these levels less than 5.5% is key, and even 5.2 or less is optimal. Western medicine actually uses hemoglobin A1C to make the diagnosis of diabetes when it's over 6.5 and pre-diabetes when it's over 5.7. Why would you want to wait for it to get there? Knowing early allows you to take action now. Number 3, fasting insulin. This is another critical level, but it's often overlooked in standard biomarker panels. This level should be below 5 to indicate good metabolic function. A high fasting insulin level is often the first signs of metabolic disease. Number 4 is triglycerides. Elevated triglyceride levels are also a key sign of insulin resistance. Aim to keep this level under 100 milligrams per deciliter. Number 5 is actually not a blood test at all. It's getting a tape measure to measure your waist circumference at the level of your belly button. This is a strong but simple and effective indicator of visceral fat, which can signal metabolic dysfunction. Visceral fat is the fat that is under the muscles of your abdomen, wrapped around your intestines, in your liver, and other organs. It's the fat that gives you a round, swollen-appearing abdomen, sometimes referred to as a beer belly. Sadly, it's incredibly common, especially in men. Visceral fat actually secretes hormones and cytokines that create inflammation, so it's much worse than any other fat in your body. Number 6 is your skeletal muscle mass. You can get an indication of this with a bioimpedance scale or more accurate measurement with a DEXA scan. How does the amount of skeletal muscle you have relate to your metabolic health? Well, your metabolism lives in your muscle. It's where most of your mitochondria are, and approximately 50% of the mitochondria are in the muscle in your body. And you have direct control over how much muscle you have, and therefore how many mitochondria you have. So what you can actually do, if you're one of the 90% plus of people that have some degree of metabolic health abnormality, the good news is it's not a death sentence. In fact, we see people every day that reverse metabolic disease in just months. Getting 8,000 steps a day, strength training, optimizing your sleep, avoiding ultra-processed food, and having stress reduction techniques can help you lower your risk of metabolic disease. Also, new trends like sauna therapy, intermittent fasting, or even cold exposure can impact metabolic health. One of the best tools for improving metabolic health, which in my opinion is a modern medical miracle, is a continuous glucose monitor, also known as CGM. This small device tracks your blood sugar levels in real time, showing how your body responds to different foods, exercise, stress, and sleep. It's a tiny filament of a needle that goes into your arm and stays there for a couple of weeks while it transmits your current blood glucose level every 5 minutes to your phone. It used to be that you had to have a doctor's prescription to get one, but now you can get them over the counter or even online. It's important to pair this device with a smart app to help you dissect the results. My favorite one of these apps is called Levels Health, and I have a discount code for you in the show notes. This app actually uses AI to recognize pictures of food and tie those into how it is affecting your metabolic health. When you get the data back from the app, you will see that you will actually get a curve for what your glucose is doing over the course of the day. What you're looking for is a flat and narrow glucose curve. That means your blood sugar stays relatively stable throughout the day without too many dramatic spikes and crashes. If you get a spike, you want it to last not a long time. It should return down to baseline within the next 2 hours. Prolonged spikes can lead to inflammation, oxidative stress, and insulin resistance over time. Using a continuous glucose monitor helps you identify your personal triggers for glucose spikes, whether it's a certain food or eating late at night. It's like having a personalized metabolic coach in your pocket all the time. The CGM is also a great example of the concept of N of 1. Every one of us has different reactions to different foods, different food preparations, and even different microbiomes, and genetics actually play a role as well. When you get a CGM, what I usually recommend is for at least a 6-week trial, do daily micro experiments with different foods and eating patterns to see what works for you. I actually personally found that eating bananas was really bad for my own glucose curve, as well as going to bed within 3 hours of my last meal. Here are some of my top 10 strategies to manage glucose spikes and support better metabolic health overall that I empower many of my patients with when they start their own mini experiments on their own CGM at home. Number 1, start your meal with fiber. Vegetables or a salad before your main course slow down glucose absorption. Number 2, pair starchy carbs with protein and fiber. This combination helps prevent sharp glucose spikes. Try to never eat starchy carbs or sugar alone. Number 3, eat smaller portions of refined carbs. Things like bread, pasta, and sugary desserts are better considered for after-dinner treats rather than at the beginning of a meal or the main dish of a meal. Number 4, go for a walk after your meal. Even a 10 to 15-minute walk can lower your post-meal glucose levels, and this is especially important after dinner. Number 5, avoid sugary drinks. Liquid sugar, like in sodas or juice, hits your bloodstream fast. Number 6, try time-restricted eating. Limiting your eating window to 8 to 10 hours improves your insulin sensitivity, particularly if you only eat when the sun is out. Number 7, get quality sleep. Poor sleep can spike glucose levels and increase insulin resistance. Number 8, manage your stress. High cortisol levels from stress can elevate your blood sugar. Number 9, stay hydrated. Dehydration can impair glucose control, so drink plenty of water. And finally, number 10, experimenting with vinegar. Although it doesn't work for everyone, a tablespoon of apple cider vinegar diluted in water before meals can blunt glucose spikes. A really great book that is an easy read that I have every patient get when they're going through their CGM journey is called Glucose Revolution by Jesse and Shupe. It's a great read and a great primer on how to control glucose spikes. Lastly, there are some new medical therapies that you should talk to your doctor about and consider if you have metabolic health issues, particularly if you've tried everything else and you're still struggling. GLP-1 medication, like semaglutide or tirzepatide, can be a game changer if paired with all of the above techniques as mentioned earlier. A new class of oral medications called SGLT2 inhibitors are also very effective. Lastly, metformin is tried and true in the medicine category to help treat metabolic disease. There are also supplements that can help you manage your metabolism, like omega-3s, vitamin D, magnesium, and special probiotic strains like the ones found in a supplement called Pendulum. Metabolic health is one of the most powerful levers that you can pull for long-term health, energy, and vitality. By focusing on your mitochondria, tracking key biomarkers, and using tools like the CGM, you can make targeted changes and really move the needle. And by using strategies like flattening your glucose curve, you're setting yourself up for a longer and healthier life. If you want a quick guide to assessing your own metabolic health, go to my website at www.drshah.com/metabolism to download a PDF guide. Thank you, and please share this episode with a friend or family member that might be interested in improving their own metabolic health.